if we're going to rebuild and transform our organizational cultures, it will not be driven by high-level words, these standardized leadership competencies, because everybody understands those things differently. And so just recognize that if we're here to help people, we need to ask what matters to them. So with this in mind, Mike, give us an example of how 2 to 3 key stakeholders in a healthcare system, whether it's a physician, a nurse, a president, supply chain leader, can harmonize the culture differently, yet still strengthen the culture's core purpose.
Starting at the top, there has to be that congruence between word, and action. So everybody who's a part of the healthcare ecosystem, and it is a complex ecosystem, where every piece has to be working right. Every team member, has to be there. And ask them, hey, what do you guys? We can react to this event in a lot of different ways and do stuff, for the sake of doing it. But we want to know what you think as our frontline team members. And we got some really good responses from our frontline team members on how we can do things differently that some of us wouldn't even have thought of. But one of the comments was, thank you for having a forum where we are able to share. Everybody within the team has to be empowered, but if you don't have a culture that enables that, nothing else matters.
How do you define culture in the age of standardization versus the age of personalization? Because you have a very interesting perspective on this that I think will open people's minds to where this conversation is going.
We're working on this journey right now, right, to redefine who we're going to be as an organization. We think about the culture within the organization. A lot of times organizations will say, all right, well, we got a mission, vision, and values. It's sitting on a page, and then this is what you need to do. But it's far more than that. What does that really mean on this team, that we are saying that we are about excellence, or that we're about safe care? What does that look like, right? There's protocols to follow, but it ultimately becomes a little bit of not just the protocol, but the individual interaction around that standard that really can make it feel personalized, even if it's a standard. So make sure we got the right leaders in the right seats that are pushing towards a brand new organization that we've been trying to create.
What does this mean towards forging a culture of trust, David? This is really important.
When I saw your topic and the work that you're doing, Glenn, on personalization, it connected in such a meaningful way with the work that I've been doing as a hospital CEO. And I found these things that were common among the best leaders in the country, and it connected to that personalization. The way that we make a meaningful difference in the lives of the people that matter the most to us, when we get that opportunity to meet with our team members, ask great questions and encourage positivity. And I think we have to be able to tell people in a very authentic way how important they are, and the work that they do matters. And that's a foundational shift over what we're used to. And that's how we gain that personalization.